Andrea Logan, a pediatrician from Singing River Health System. And Dr. Logan, thank you so much for joining us. And of course, such disturbing numbers. And we are seeing more children hospitalized across the country, including right here in Mississippi. There was a sixth child who actually died in Mississippi, reported yesterday. Just tragic news. And what are you seeing at Singing River in terms of children?
So here in my outpatient clinic, yes, we are seeing many more children with COVID than we've seen in either of the previous two waves that we've had come through. The vast majority, thank goodness, children, it's a cold. However, just like with many viruses, there are rare complications that can develop. You know, we talk about this with other viruses all the time. That's why I talk about flu vaccines every year. That's why we vaccinate against other diseases, right? Chickenpox is usually pretty mild for most people, but it rarely can be very severe, and so that's why we started having a chickenpox vaccine. So what I want to tell parents is, you know, it's serious. We don't want to be flippant. However, don't be totally in a panic, because the majority of children are experiencing mostly upper respiratory cold symptoms.
But you are seeing a difference in terms of symptomatic kids this time around during this surge, and most likely caused by the Delta variant?
Correct. It's dramatically increased. In fact, if you look just at the state statistics on the proportion of which age ranges are having the positive tests, you'll see the bulk of, like, the majority are from, I just had it pulled up, the 11 to 20 age. So these guys are getting COVID. They are probably spreading COVID. It's a different ball game than it was last fall. Last fall, you know, you didn't see very much spread amongst the children, and this year it's totally different. My own children actually returned to school today because they have personally been out with COVID this past week.
And the last question, Dr. Logan, as far as vaccines and kids, are you seeing any more interest in it now that Pfizer has been officially approved by the FDA?
Of course, the Pfizer approval, FDA full approval, is for 16 and up, but they are still under the EUA for 12 to 15. I continue to encourage 12 and ups to get that vaccine. You know, our community spread is just, it's wildfire right now, and the more people we can get vaccinated, the better we can get this under control. I mean, as far as I'm concerned, the vaccine for 5 through 11-year-olds can't come out soon enough. It's rough. It's rough times.
All right, some very good information coming from Dr. Andrea Logan today from Singing River Health System. Thanks for joining us.
Thanks.